my job is Director of Nutrition Security and Health Equity at the Food Nutrition Service, which is a brand new position to USDA. And my charge is to execute on the Secretary's vision around nutrition security, which essentially means consistent and equitable access to healthy, safe, and affordable food that is essential to good health and well-being. And for me personally, it's such a privilege to be able to work at USDA on these programs because as a child, my family received SNAP, which formerly was food stamps. We received WIC. We received school meals for a period. And so now I have the privilege of trying to make these really strong programs even stronger. First and foremost, it is so important that we use the nutrition assistance programs, of which there are more than 15, and they together serve 1 in 4 Americans over the course of a year, that we not just use them to help all who are eligible, but we also use them to disproportionately benefit in a positive way those who are historically underserved. So just as an example, now almost all folks who participate in SNAP can use their benefits online. And this is a game changer because it puts healthy food within reach. We are also working with a pilot project to bring the WIC program online, which is also going to be a big change for folks that participate in that program. The second thing is that food security is associated with a host of negative outcomes. So things like diet-related diseases, and we know among children that children who are food insecure are more likely to have problems with academic performance, with behavioral problems, and so if we can get a handle on food insecurity, we will meaningfully impact equity. And then the third thing is that the #1 message that I took away from the White House Conference on Hunger, Nutrition, and Health is that the problems of diet-related diseases and disparities are almost entirely preventable. So they're not easy to solve, but if we have a whole-of-country approach and we work toward ending hunger and reducing diet-related diseases and disparities by 2030, we will make an impact on health equity and improve it in a meaningful way. What's important for listeners to understand is that all of this nutrition security work is building on and complementing decades-long work at USDA around food insecurity. So we're not getting rid of food insecurity, we're continuing that focus, but we're widening the aperture to recognize that diet-related diseases and disparities are a huge problem right now, that we need to address them head on. And so the distinction for folks to understand about what is it that's different about nutrition security compared to our past efforts is one, that we're really prioritizing equity, and two, that we recognize that systematic inequities make it hard for many people to get access to healthy food.